Recording in progress.
Thank you, Reba. And good morning, everyone. Welcome to our mid-morning session for your Building Bridges community experience. I'm Jennifer Nail. I'm the Reentry Coordinator with the Ohio Department of Rehabilitation and Corrections Office of Reentry for the Cincinnati region, and I will be your facilitator for this session, which is putting research into practice. We're going to build on the presentation from this morning, and for today's sessions and tomorrow's in-person events, it's our hope that you're finding great information and connection and a little bit of inspiration. While I have the floor, I also want to thank Reba Collins. Reba is with All in Community. She's the leader that makes this event possible every year. She works really tirelessly to bring us together statewide. I know from experience it can be like herding cats. So please find a moment over our 2 days together to acknowledge her efforts. Reba, thank you for everything that you do for us and with us. So as we get underway, just a couple of housekeeping items. This session is being recorded. You'll be able to access this recording at a later date on the Building Bridges of Community Experience YouTube channel. During our presentation, just as we did this morning, I'm going to ask our audience to disable their cameras just to minimize distractions, and please make sure that your microphones stay muted so that our presenters can be heard clearly. During the question and answer, you'll be okay to make use of your cameras, and I'll ask you to unmute during that time as needed. So take a moment to make sure that you're familiar with the icons for microphone and camera along the bottom of your Zoom window. I'll be monitoring the chat during today's presentation if anything comes up. So enough out of me. Let's get underway. A brief introduction for our presenters this morning. We're joined by Brooke Burns with the Youth Defense Division of the Office of Ohio Public Defenders, Ruth Simera with NEOMED Coordinating Centers of Excellence, and Brittini Long from the Department of Youth Services. She's the Reentry Resource Administrator. And these women can tell you a little bit more about themselves, but they bring a wealth of experience. I'm excited for you to hear from them. So ladies, I will turn it over to you. I will pop in if I'm needed, but I'll be watching the chat and right here off camera. The floor is yours, and thanks for being here.
Thank you, Jen. Thank you for having us. Good morning, everyone. I know that Ruth and Brittany and I are very happy to be here, so we'll jump right into kind of our content and hopefully put some more legs on information that you heard earlier this morning. So this morning, we're going to take a look at kind of three buckets. First, we're going to start with an overview of youth justice and what our system looks like. I'm going to share a little bit of a national landscape with you all, as well as get into some details about Ohio specifically. What I hope to do during this first portion is to dispel some myths that exist in our youth justice system to help folks better be able to serve young people who are re-entering their communities and going home after time incarcerated. And then we'll hear from Ruth, who's going to talk about sequential intercept mapping and show you all the neat work that NEOMED has been doing. And then finally, we'll finish up with Brittany talking to us about what are the practical things that we can do given all of this information. So first, I kind of wanted to paint a picture of grounding us in this space of what youth justice has looked like on a national or historical perspective. And so way before the kind of separating out of a youth justice system, young people were actually treated the exact same and in the same system as adults. And it wasn't until the late 1800s that we decided as a society that we needed to have certain specialized spaces for young people who have committed offenses, violated the code, for them to be treated. And so what we saw is this kind of burgeoning of a new space where we had to get our legs under us a little bit. And so at first, when the youth justice system started, we saw it was driven mostly by social welfare. And so we didn't really see a lot of due process for kids in that space. And so you'd see maybe a young person who was not listening to their parents or violating the rules at home could be sent to a workhouse for years, or what eventually became known as an incarceral setting or a detention center. And now we've moved around mid 1960s, kids won due process in cases like Galt and other US Supreme Court decisions. And so we started to see the juvenile court being treated as this quasi-criminal, quasi-civil space where kids kind of exist in two different worlds, where the criminal justice part of it sees a harm to the community and a need to kind of step in and intervene. And the social aspect sees, well, these are young people and they are youth who are likely system involved because of their own needs. And so we've kind of got a system now that tries to blend those two spaces together. Now, when we look at kind of youth offending rates, and this is going to be important for the first myth that we're going to bust, I want you to take note of kind of this overarching trend as we see this mountain kind of move downward between 1980 and 2020. Now, in the 80s, we saw this boom in the prison industrial complex. And so we saw across our country, in the adult system and the youth system alike, we saw increased rates of incarceration. We heard, if anybody who was around in the mid-90s and doing this work is probably familiar with the super predator myth, which was this idea that there was a group of incorrigible kids who were going to be committing lots of crimes. And so what we saw in this mid-90s space is we saw lots of increases in mandatory sentencing, mandatory dispositions, even for young people. But what we did not see is a co-occurring kind of fulfillment of that super predator myth prophecy. Instead, what we saw is we started engaging in better practices around providing services for youth that met them in the space of their need. And then we saw this downtrend in youth arrests. And so that's kind of what this graph shows here. NEEKC Foundation and the Sentencing Project in different spaces that I'll mention throughout this first part of the presentation have a wealth of information that give amazing data on what it is we've seen in youth justice space. So this first one is this arrest. And you can see this steady downtrend where we have youth arrest rates at record lows. And the reason why this is important is because the first myth we're going to kind of touch on is this notion that youth crime is on the rise. And so I don't know about you, but I know in my own community and across our state, lots of the headlines that we see talk about youth offending being on the uptick or increasing. And so we all know, or at least I know as a person who works in this space, that part of the danger about allowing a myth to kind of exist and continue is we know that we start to set policy based on kind of the public consensus. And so if people think that youth crime is really on the rise, then we're going to start to see policy that reflects that thought. But the reality is youth crime is actually still in that low swing that I showed you with that arrest record. So crimes committed by young people in the US has actually fallen over the last 2 decades and continues to fall in all major categories. And the data that we have up through 2020 nationally shows that that has still remained consistent. So the number of violent crimes, including murder, aggravated robbery, aggravated assault, has been on a decline for nearly 2 decades. And in 2020, so right at the beginning of the pandemic, the number of kids arrested for violent crimes actually hit a new low, 78% below its peak in 1994. And that's actually half of what it was in 2010. So what researchers have seen nationally, the Sentencing Project has done some work, is that there was a slight blip in 2023. That seemed more to be an anomaly as the system started right-sizing itself post-COVID, but that even that slight increase was still at a deficit when we think about youth offending over time. In fact, people age 17 and younger generally since around 2020 commit only 6% of arrests nationwide. So that's what this little pie chart is showing, is that the youth arrest is only 6% of total arrest. Now, why this is important is we actually see young adult offending. So so folks ages 18 to 24, that number has increased. And in fact, it's increased to the point where we're seeing people under 18 as increased victims of folks who are 18 to 24. And now the reason why language is important is because young adult crime, even if there's an increase there, that does not equate to youth crime also going up. And so that's really important because here in Ohio, if you are under 18 at the time that your case starts, you are considered a child, and Ohio's juvenile court jurisdiction goes until a youth's 21st birthday. So you're considered a child until age 21. And so when we think about the population of young people who are being arrested for offenses, when we say youth, we mean under 18. But just keep in mind that we can't conflate the two because jurisdiction is different. Folks who commit a crime over the age of 18 are considered adults and prosecuted as such. And so we need to be really careful that when we think about what we're hearing out in the media, that we're really talking about apples and apples, or in this case, youth. Okay, so just another statistic on the 18 to 24-year-olds, young adults in that age range actually accounted for 3 times the share of violent crime arrests as those under the age of 18. So it's really important to think about when we're talking about youth crime being on the rise. You can say that is not true. Youth offending is actually down overall and historically, and that becomes important when we think about policy and when we think about what sort of interventions can we bring to young people. All right, to give, so those were kind of national numbers, but to give Ohio numbers, just to show you that we're not an anomaly, that we're also following the same trend that we see across the country. So if you look at delinquency case volume, this is astonishing to me, mostly because this is an incredible number. But as recently as 2002, we were seeing more than 143,000 cases go through our delinquency courts annually. And over time, we have seen a steady decline in that number, resulting in 2024, 35,012 cases. And so that matches what we've seen on the national level, like this steady decrease in youth offending. Even if you look at our felony adjudications from 2012 at 5,074 felony adjudications, which means most of those other adjudications were not felonies. They could be misdemeanors, they could be unruly cases. But felony adjudications also fell from that 5,000 number down to just a little over 3,000. We've also seen a corresponding decrease in our facility footprints when you think about the deep end of our youth justice system. So we've gone from having 11 main facilities in our Department of Youth Services down to 3 main facilities currently. And so that's important because when you think about the need and the number of young people coming out and coming home, it's not an overwhelming number, but it is just to help contextualize what youth offending rates actually look like. The same thing can be said about our confinement rates. Youth confinement has decreased since 1995, also tracking right along with youth arrests. And we've actually seen most states reduce confinement with that chart from Annie E. Casey Foundation. And so that's a trend that we're seeing across the country, which in my mind is a good trend to have, is to see less incarceration for young people. And in a minute, we're going to talk about why that's important. So here's our second myth. And that is the first myth, the first myth was, about crime in general. The second is about the population of young people who end up incarcerated in our system. So the myth is detained youth are a public safety threat. And what we actually know from national studies is that that's really not necessarily the case. We actually see 76% of our young people who are detained across the country are being held for offenses that are nonviolent, that are property offenses, drug, public disorder offenses, things like that. Whereas the violent person offenses make up almost about a quarter of the things that youth are held in detention for. And so that brings us to this next and related myth, which is that incarceration is necessary for crime reduction. Dr. D'Amato talked about this in his presentation about how over-incarcerating or over-involving young people can actually make things worse. And there's a lot of research out there about this. In reality, light touches are the most effective intervention at reducing recidivism among young people. And so there's this study done by Lawrence Steinberg called Pathways to Desistance. And one of the things that it talks about is kind of this criminogenic curve that exists for people with underdeveloped brains or teenagers. And what that study says is basically without any system intervention, most young people will age out of criminogenic behavior and thinking patterns in their early to mid 20s. And so that's even without us doing any sort of system intervention at all. And yet, when we think about and know the impact of over incarceration, we see that over incarcerating kids is actually fairly harmful. So studies done by the University of Cincinnati, Annie E. Casey, and the Sentencing Project have found that more than 6 months of incarceration can increase recidivism among some populations. There's a 2020 study that showed a 33% increase in repeated felony behavior with youth who'd been incarcerated versus youth who were kept in their communities. We know that incarceration reduces the likelihood of high school graduation. This is even true for young people who spend just a single night in detention. Annie E. Casey research has found that that increases the risk of not finishing school by 38%. So there's a number of problems that come from over incarceration. And the reason why this is important for us to know, and especially you all who are attending this conference, is when we think about what makes the community safer, I think a lot of people assume incarceration is what makes the community safer, but that is not what the research shows. Instead, we know that providing young people with adequate support, we know that providing them with treatment for their own victimization, those are things that actually have much better outcomes. Diversion is actually the youth justice system's most helpful intervention for young people who've been charged with violating the revised code. So this is something to keep in mind when we think about policy, when we think about how we craft programs that help young people who are returning back home to their spaces. All right, so the next and related myth we're going to talk about is the makeup of our young people, specifically here in Ohio, who end up at the deep end of our system. And so deep end of the system, generally speaking, is incarcerated at the end of their case versus being held at home in the community setting and being able to get maybe a treatment that is inpatient or outpatient at home. So the myth here is the most serious consequences are reserved for the most serious offenses. I think that's a myth that a lot of people like to believe, that we only incarcerate when necessary, and that typically when we do so, we've only got this phrasing, the worst of the worst, right? So when you take a look at fiscal year 25, and we see out of 435 admissions to the Department of Youth Services, if you take a look at that orange highlighted line, felonies 3, 4s, and 5s, so those are our lowest level felony youth, those kids actually make up about 30% of the kids who are incarcerated in DYS in Ohio. That's pretty significant. That's probably, it might be, and I can ask Ms. Frierson for the specifics if she's still here, but that might be almost an entire facility worth of young people. And so kids who have committed those felonies, 3s, 4s, and 5s, those could be offenses such as receiving stolen property. It could be vandalism. It could be something that maybe happened at school that was a school fight that didn't turn into serious physical harms and didn't rise to the level of a first or second degree felony. And so typically, a lot of those F3, 4, and 5 youth are not those high-risk kids who might be assessed as needing congregate care in their case. When we look at the numbers for our youth transferred to criminal court, we see that out of 175 for the most recent fiscal year that we have data for, felonies 3, 4s, and 5s make up only 6%, which is better. It's better than what we've got on the deep end of kids who stay in the juvenile system. But look at that number of 58.2% who are felony 1s and 2s. The vast majority, or the most frequent offense that we see young people being bound over for, is an aggravated robbery, usually with a firearm specification. And so if those youth who were 16 or 17 and they had a gun and they committed a robbery, that is what's known as a mandatory bind over. And so courts don't have any discretion to decide whether to keep those young people inside the youth justice system, and so they go to the adult system. One of the things that we have found, though, in Ohio, and we did this with fiscal year 2018 data, is we followed all of the kids who'd been transferred from juvenile court to criminal court, and we wanted to see what happened with them afterwards. And what was pretty disturbing is that we found that more than 55%, or actually, I think it's more than 62% of those youth who were bound over to the adult system ended up serving less than 5 years or no time at all in the adult prison system following their adult conviction. Well, why is this important? Well, one, it's important because remember earlier I said that juvenile jurisdiction goes until age 21. And so that means that the juvenile system for kids who are retained can continue to provide services, rehabilitative intervention, therapy until the child's 21st birthday. And what we found is a lot of young people who were bound over to the adult system ended up only staying in the adult system until or right at their 21st birthday. So those were kids who could have gone on and stayed in the juvenile court and received services. They could have had mandated education. They could have gotten therapies, behavioral health treatment, mental health treatment and support. And so a lot of young people who end up in Ohio, who end up being transferred, lose the benefit of that adult system, but only, or of the juvenile system, but only stay in that adult system for very short periods of time, which means that when they come out and they are released home, they haven't had the benefit of a lot of the therapies that their counterparts who stayed in youth justice had the benefit of. And so that's something to keep in mind as well, as we're thinking about how old a young person was and which system they were in when they came back home. So another space that I wanted to do some myth busting, especially for those of you who are going to work with young people and maybe that young person has a background in sexually oriented offending. A common myth is that youth with sexually oriented offenses pose a significant risk to public safety. Fact is that youth with a history of sexually oriented offending have the lowest recidivism rate of all young people who are system involved. So the largest meta-analysis, which Dr. D'Amato defined for you earlier, on a collection of research of youth sexual offending demonstrated a recidivism rate of less than 2.75% for youth who are 5 years post completion of their case or post-release if they had been incarcerated. And so this means that the kids with sex offenses in their history are really, really rarely going to reoffend sexually. And this is across all different offending types. And the reason I bring this up is because we know that our young people who have sex offenses in their background following their juvenile court involvement, especially if they end up on the registry, have severe disruption into community reintegration. And there's a number of reasons for this. The picture that I've posted up here is from a study called done by Human Rights Watch called Raised on the Registry, and it is a 50-state survey of more than 500 young people who ended up on the registries following their juvenile court involvement. And when you listen to their stories or read their stories, you can see how the registration actually interfered with them being able to complete school, interfered with them being able to get a job, interfered with them being able to, depending on the state that you're in, live in certain places. Here in Ohio, kids on the registry aren't subject to residency restrictions, but that's not the same case across the country. And what really horrifying things that we also found, or that's detailed in the report, is that young people who are on the registry actually end up being more likely to become victims of sexual offending by adults because they are physically going to a sheriff's office to register. That demonstrates to potential grown-ups who are registering that that is a young person with a history in the system specifically for sexual offenses. And so those kids' victimization rates go up. Incidences of suicidality go up for young people who are on the registry. And if a young person who has a sexual offense history is likely to commit a new offense, it's usually not sex offense related. It's usually related to the fact that they cannot work, they cannot go to school, they cannot find gainful employment because of their registration status. And so when you're thinking about what type of interventions or work can you help to do to support young people, know that this particular group of young people is at is at great risk for not being able to successfully reintegrate. All right, a couple more myths before I turn you over to Ruth. Here's a myth that unfortunately I think is pretty pervasive among general community members, and that is that the youth justice system treats youth equitably. The reality is that the youth justice system disproportionately impacts Black and Brown children. And so at every single stage of the proceedings against them, starting with arrest, leading all the way up to sentencing, we see disproportionate impacts for Black and Brown youth. The reason why it's disproportionate is because it doesn't match the percentage that these young people exist in the community. It also does not match the percentage that these young people commit criminal offenses. Contrary to what that myth suggests, Black youth do not commit a disproportionate amount of crime. Yet we are overrepresented at arrest, formal processing, detention, adjudication, and disposition. Annie E. Casey and the Sentencing Project have done some amazing research kind of demonstrating the frequency with which this happens and regionally how it happens. I hate to tell you, but Ohio, we are among the worst for disproportionate impact on youth of color. And part of the reason for that is implicit bias. All of us carry it with us, and so I will not turn this into a whole implicit bias hour, but just realize that the same biases that exist in us in our everyday work exist in the system as well, and that unless we are aware of that, we can unintentionally impact the outcomes for a number of young people based not on their actual need, but based simply on how the system has ratcheted up surveillance policies, arrest, formal processing in a case where maybe that was not what the necessary intervention was. All right, and last but not least, before I turn you over to Ruth, the myth that youth who are returning home have access to all the services they need is probably a big one for this space. The reality is there are always significant gaps in what youth need and what resources are immediately available upon their return home. Recently, the Sentencing Project released a study in 2024 that looks at what is the cost of incarceration for young people and how does that disrupt their ability to re-engage with their communities. Some of those disruptions are educational. So maybe records might not follow the young person back home to their home school if they didn't graduate while they were incarcerated. So those delays can interrupt reintegration. It can also dissuade kids from finishing school. We see that kids with a history in the youth justice system and incarceration in that system, pursuit of higher education is generally negatively impacted. It disincentivizes lots of kids to apply for college. Some of them find it really difficult, that process. And if you remember, Dr. D'Amato talked about that normative behavior becoming antisocial behaviors, and how for a lot of our kids being incarcerated during their adolescent years means that they don't really get to do a lot of the normative trial and error that other kids do. And so they come out not feeling as prepared to pursue some of those opportunities. Also, we see poor health outcomes, mental health, continuity of care is a big issue. Kids really, it's hard for them to be able to reconnect with a primary care provider, to be able to get a new prescription on maybe medication that they were doing really well on when they were incarcerated. And so to the extent that your organizations are considering how it is you can walk alongside youth who are coming back home, that is an area of big need for a lot of our kids, as well as dental care, eye care, primary health care. Those are really difficult appointments for kids to necessarily make on their own and not necessarily at the top of their list. Like teenage boys, I have one at my own house, aren't frequently going to be able to navigate those systems very well without some assistance. And then other things, basic documents. So things that we might take for granted, like birth certificates, social security numbers, and cards, things that they'll need to be able to meet their parole requirements, are things that would be really helpful if organizations would be able to step in and assist young people with getting access to. So with that, I will be quiet and turn it over to Ruth, who's going to talk to us more about sequential intercept mapping and what it is that we can look for when we're looking for services for young people.
Wonderful. Thank you, Brooke, and thank you in advance for working the slides for us as a team today. So first, for context, I am with Northeast Ohio Medical University in the Department of Psychiatry. And so to explain kind of what my role is in all of this work, I want to share a tiny bit about the centers that are involved here and then move into sequential intercept mapping. So NEOMED's Department of Psychiatry is home to 3 statewide coordinating centers of excellence: the Ohio Program for Campus Safety and Mental Health, the Criminal Justice Coordinating Center of Excellence, and the Best Practices in Schizophrenia Treatment Center. Now, all 3 of these centers work with partners across the state and a wide array of community organizations to provide training, technical assistance, education, etc. Our goal is to improve local programs and practices for people who have serious mental illness or mental disorders throughout the state. The thread is, right, so the Criminal Justice Coordinating Center of Excellence encourages communities to collaborate and forge collaborative relationships between mental health, behavioral health, criminal justice systems to help each community develop effective practices and programs. The Ohio Program for Campus Safety and Mental Health promotes a comprehensive approach to mental health, campus safety, and academic success on Ohio campuses. And then the Best Practices in Schizophrenia Treatment Center, or the BEST Center as we call it, promotes the adoption of evidence-based and promising treatment practices for individuals with mental illness who experience psychosis. So the common thread here is that these 3 centers are working together to try to ensure that no matter where anybody lives, studies, or stays, they have access to the best possible and effective care, health-facing care, if at all possible. So next slide. So the Criminal Justice Coordinating Center of Excellence is the center that really works on the sequential intercept mapping. So first of all, what's the sequential intercept model? The sequential intercept model was developed in the early 2000s by Dr. Mark Munitz, who was the prior chair of the Department of Psychiatry here at NEOMED, and Dr. Patty Griffin, who's a forensic psychologist in Pennsylvania, in collaboration with Policy Research Associates, and they operate SAMHSA's GAIN Center for Behavioral Health and Justice, SAMHSA being the Substance Abuse and Mental Health Services Administration of the federal government. The purpose was to develop a framework or an organizing model, if you will, that could be used as a common tool across systems to discuss the intersection of behavioral health and criminal justice systems as it pertains to the overrepresentation of people with mental illness in our justice systems. And there is an overrepresentation of people with mental illness in our justice systems, both on the adult side and on the juvenile facing side. The original model that you're seeing here, this is the linear model, was designed for the adult mental health criminal justice systems. And there was an original paper published in Psychiatric Services in 2006, if you want to look that up. The result was this framework breaking the justice response into logical sequences. So what they determined across the country was that people move through our justice system in very predictable ways. So the model works across jurisdictions and across states. It illustrates key points to intercept to ensure that we can look at prompt access to treatment, no matter where you are in the justice response, look at opportunities for diversion and therefore avoidance of further penetration into the justice system, timely movement, and linkage to community resources. Let's go to the next slide. So in 2007, the Blueprint for Change, which was subtitled A Comprehensive Model for the Identification and Treatment of Youth with Mental Health Needs in Contact with the Juvenile Justice System, was published by Kathleen Scalra and Joe Kokoza, who worked with the National Center for Mental Health and Juvenile Justice, also part of Policy Research Associates. And they had identified these 7 critical intervention points in the justice system. And if we'll go to the next slide, I'm going to show you the linear model, the adaptation that we use to illustrate the cross systems mapping that we work on. So this helps to depict that flow, right, of the justice system. It's exactly the same as what they had outlined, except that we consulted with our Ohio experts working in the justice system, and they recommended that at intervention point 2, we put intake and initial detention together because they work hand in hand, and our juvenile courts in Ohio very much kind of take on both of those components. And so we could look at that a little bit more holistically. So we use this as a framework to try to transform fragmented systems, assess local gaps, opportunities, identify where to begin interventions, and I'll talk more about that, and then identify opportunities for deflection of kids and diversion. And you've heard a lot about that. So on the next slide, after the SIM model, that's sequential intercept model. So after the SIM model was developed, policy research associates used that linear version that you just saw and developed an applied strategic planning tool out of it so that they could do workshops in communities to improve cross-system collaboration and hopefully reduce involvement in the justice system for people with mental illness. Sequential intercept mapping assists counties in mapping out that response. So using that linear model, kind of mapping out what they have in place on the community side and how it interacts with that justice system model to see how early they are, right, intervening, how early they are applying services, how early they are really using deflection and diversion opportunities to keep youth from penetrating further into the system. And when the mapping workshop first began, it was only for adults again. So we began in Ohio doing adult system mapping in 2014. One of the earliest counties was Wood County, and almost immediately after completing their adult mapping, they requested that we adapt the model to the juvenile system and pilot a juvenile SIM mapping in their community to align with other initiatives that they had going on at the time. So we did that, and we did it in 2014, and then we went back to work on our focused work on the adult systems, veered off for a little bit to do opiate epidemic focused SIM mapping for a couple of years, and then again returned back to the adult work until we were specifically asked to somewhat recently begin focusing on juvenile SIM mapping. And we've really started a concerted effort for that just in October of 2023. So as you can see on the slide here, the focus here in Ohio for juvenile system mapping is to really focus in on youth and families where there's a serious mental illness or maybe a co-occurring substance use disorder, comorbid developmental disabilities, for kids who are either already involved in or at risk for involvement in the juvenile justice system. And typically by that point, it means they're involved in multiple other systems as well. While I'm here, the overrepresentation of kids with mental illness really can't be understated. Research consistently reports high rates of mental health disorders amongst kids in the juvenile justice system, despite decreasing rates of secure placement and despite decreasing rates of arrests. We did a spot check at one point, and I'm sure that Brooke or Brittini could update this data today, but a couple of years ago, Department of Youth Services reported that about 73% of the kids at that point in time were on the mental health caseload. Right now, on average, about 70% of kids across the country, if they're involved in the in their state incarceration system, about 70% are on the mental health caseload. And we see that a higher percentage for girls. It's often close to 100% of girls who are incarcerated are on the mental health caseload, and a lower percentage for boys. Nearly half have special education or disability related needs. So let's go to the next slide. So the goal of what we do when we work in communities for sequential intercept mapping the goals are very similar to the Juvenile Detention Alternatives Initiative strategies, which you see here. So these strategies on the screen here are those of JDAI. The goals of sequential intercept mapping are to promote collaboration, so you see that there, promote and support recovery, so there's that health-facing piece we think is so important, promote safety, quality of life, prevent the need for any justice system intervention if we can help it and if it's appropriate, keep kids out of detention, in home, in treatment if that's what's called for. If they're in detention, to ensure that they're getting helpful care, and then to link to effective and accessible community-based services. So all of this should sound very familiar with the two presenters that you've heard already. And of course, community-based services should be based on the best known practices. Let's go to the next slide. So we work with communities for about 3 to 6 months in preparation for a sequential intercept mapping. And some of the keys to success that we discuss with them and that we cite to their community planning teams are these: that it's really important to develop some type of a task force if one doesn't already exist. We discourage duplication. So if you've got a group that's already convening, let's massage that so that it can be the task force here. And that task force should be a group that's going to meet regularly. It's going to meet regularly. It's got some kind of established structure. It has the ability to spin off small work groups to focus on really focused action planning. We encourage it to be over-inclusive. So family and youth involvement is, for us, it's mandatory. If we're going to work in a community, we want a commitment that there will be family members and kids at the mapping exercise. And that's challenging because sometimes they're during the school year, school day, and we're happy to help, maneuver and do what needs to be done to get them there. We are seeing some challenges with that, most specifically associated with, since there's so many paid peers now in our systems of care, that's kind of the easy response is to, we've got a peer that's on staff and to bring them. But what I will tell you anecdotally is that the paid peer voice is different than the voice of the families and the kids that are currently involved in the system or have recently kind of graduated or made their way through that system of care. So we really ask for family and youth involvement that's kind of fresh and where they can give good feedback. It's just a different voice. Boundary spanners are important. So people that can really talk on various sides of the issues and that people trust. And we strongly encourage them to think both big and small. So we want communities to have momentum getting out of the gate. Don't try to take everything on all at once. You're going to have some big issues that come up, like transportation, countywide transportation, right? That might be too much for the group. But what can you do about one specific thing first so that you can feel some progress is being made? And then, of course, communication and information sharing, which you'll see come up time and time again throughout my presentation. Let's go to the next slide. So what does the workshop look like? It's 1.5 days on site after that 3 to 6 months of preparation where we've gathered a lot of information, we've prepped them. There's a lot of responsibility on the community side. But once we get there, there are up to 40 people sitting around a table representing various aspects of the community and the response systems that the county has in place. And the first day, we spend time, basically the stuff you heard Chris D'Amato talk about today, that's in our lecture, if you will, our mini didactics about each of those intercept points. We talk about what the challenges are known to be, what the best practices are. The reason we do that is partly to inform, but partly to get the folks sitting around the table to start thinking about, okay, when it comes to that, what are we doing? How do we kind of stack up against that? And therefore, when we get to the inquiry piece of it, which is the brunt of the day, they are ready with their responses to tell us what they're doing really well, what they're not doing well. And we have pages upon pages of questions we can ask to explore those things, but there are themes to that. So we do we introduce the sequential intercept model. We talk a lot about collaboration and how we want that to look different. And then we go through each intervention point, challenges, best practices, and then inquiry for that intervention point, learning about what they're doing, mapping it on that linear chart, excuse me, and then identifying the gaps and the resources that they're identifying to us along the way for each intervention point. At the end of the day, we've got the gaps and resources all up on the wall, and everybody gets to vote equally on what the priorities are going to be that they want to adopt to begin action planning on the second day. Let's go to the next slide. So these are the counties that we've done so far, just 9. So I said it was young and early. To put this in context, we've completed 63 mapping exercises in Ohio across 39 counties. So 44% of the state has participated in sequential intercept mapping, but most of that has been on the adult side so far. 42 mental health mappings on the adult side and 12 for the opioid epidemic, 9 juvenile so far. And some of the counties that have done mapping have done all three types. Once they embrace this as a strategic planning tool, it tends to resonate because they get immediate results in terms of these are the 4 or 5 things we're going to work on. And then a few or several months later, a big report comes and all of the gaps they've identified in order that they voted on them are in that report. So they can kind of keep working through it if they want over time. So let's go ahead to the next slide. I'm going to just pop through these intervention points fairly quickly and just call attention to some of the things that should be familiar based on what Chris talked about this morning, right? So these are the things that not only do we discuss, but on the slide here, you'll see the green fonted items. Those are the things that tend to resonate in the community that they're bringing up also within these intervention points that they are saying are important to them. And you'll see that reflected in the priorities that get voted on. So intercept 0 is the ultimate intercept. So if you picture that as bubble wrap around the whole justice system, that should be all of your community-based stuff, everything from prevention to treatment, anything that happens prior to and or during, right, justice involvement. We like to really focus on this in terms of what do you think is working to keep people from having 911 and police contact, from ever getting to the justice system? What's happening there that's working and how do we build that up? Not unlike how you would approach working with a person, right? What are your strengths? Let's build that up and let's minimize the weaknesses. So those are pretty obvious. Intervention point 1 is initial contact and referral. So at that point, there's been some type of touch with 911, law enforcement, right? It's important to note that there are many communities in Ohio that don't have child-centric mental health agencies or services. So this intervention point can be really critical. And this is where you're going to have your largest numbers and also a lot of discretion. So it's really important that there's options here for police to exercise that discretion. One of the challenges, though, that number 1 bullet point is that we don't really know the prevalence of family and youth contact at this point. Most counties can't give us a good piece of data from the 911 center. They can't really tell you if it's a youth or youth associated. 988 still also cannot. In the last county we were just in, no data from 988 in terms of youth contacts. We expect that's going to be coming, right? I'm hopeful about that, but it's very difficult to build out meaningful responses if you don't know what the need is. So we really stress the importance of data, and I know that's challenging for places, but again, it's difficult to know what to do if you don't know how many people need it or what is needed. So at police response, right, you need some choices. You need alternatives to detention. That's where that begins. Police need specialized training. We're very fortunate in Ohio that we're a CIT state, and the brunt of our CIT programs do train on youth responses. There's an advanced evidence-based training for CIT for youth that they can adopt in their programs. But all of these things are important because if they're not there, then poor outcomes do occur. Let's go ahead to the next slide. Intervention point 2, so there's that intake and initial detention. So we take a look at what's happening there in terms of how are you screening kids for whether or not they'll be confined or released. What assessments are you doing? What risk assessments are you using? The Ohio Youth Assessment System, which looks at those risk, needs, responsivity pieces, right? Are you doing clinical screening to determine if there's mental health needs, trauma-related needs? Who's making the decision? Is it the judge? Is there an intake officer? How is that decision being made? And when is in some communities, resources are not rich, and the kid might sit there all night long until somebody comes into the office in the morning and makes that decision. That's not ideal, right? Confinement is confinement. You've heard that. We want to avoid that. Where I really have a bee in my bonnet is around that third bullet point, both on the adult side and youth side. This is a common thread that oftentimes people are alone in that first hearing, and they're alone and they're on video in a small room. Kids too. I was pretty surprised when we started visiting the detention centers and the courts to learn that. I think it was partly a post-COVID thing that just hasn't been corrected for and maybe being taken for granted, that a kid can be sitting there alone in a hearing with a judge. And I this is me personally speaking now, I find that unacceptable. I just don't think that's okay. I think there needs to be a trusted adult. We do know on the adult side that earlier legal representation is associated with better outcomes for people with mental illness. My belief is that that's likely true with kids, but I don't know that's fully been tested out. How are they handling status offenses? We'd like to think that there aren't any kids in detention with status offenses, but I just looked at the 2025 national data, and there's a couple hundred or so in the country that are being held in confinement that are on status offenses. And that's also not supposed to be the case. So we do inquire about that to find out. And some of our communities in Ohio are still detaining kids with status offenses. Diversion services, what do they have available at all these different levels? Status offenses, there really ought to be diversion services and non-confinement options available. Felony, misdemeanor, you heard from Brooke, right? The negativity, right, that can occur with somebody's detained. So those need to be very meaningful, intentional decisions if a kid's going to be confined. And then, of course, you've heard about referrals to community services. Go ahead, Brooke. And then intervention point 3. The good news is in Ohio, we don't hear a lot of gaps associated with what's happening in the judicial processing, but we do check on all these things in each community about what they have available to avoid criminal convictions, if that's possible, because criminal convictions are associated with, increased repetition in crime and conviction, and diversion does increase employment rates for people, adults specifically, but it also increases their earning potential. So it's, again, a decision not to be taken lightly. So what do they have pre-adjudication in their district? What do they have post-adjudication? What do they have related to probation? And then in Ohio, we always check in on, are you using targeted reclaim, competitive reclaim, the BHJJ stuff? What are you doing with that? And just making sure that they've turned over all the rocks. But this is just not an area where we see the community identifying a lot of gaps. It's before that and after that where we see most of the gaps. So that brings us to probation on the next slide. And I need to give some credit here to Dr. Brian Lovins, right, who has body of work on probation officers as coaches, and Scott McDonald, who really supports collaborative and data-driven practices to assist jurisdictions committed to very bold and forward-thinking reform. And he teaches assistance versus a compliance approach for kids and families. So on the probation side of things, there's a movement called probation renovation, and we're not technical assistance providers on that, but we are promoters of those concepts, right? So what you see on this slide are things that are consistent with that. Even if a community is not undertaking probation renovation, we inquire about some of the components of that, right? Using some of that model in order to improve practices. And that means smaller caseloads. It means training for probation officers, specialized training, so that they know better how to manage youth and families who have multiple needs. It means using incentives wise and well. It's being committed to racial and ethnic equity. And you'll see in red there, collaborative, family engaged case planning. Can't stress enough the importance of a trusted adult and family, however that's defined, for somebody being involved every step of the way to improve outcomes at reentry. And then, of course, positive youth development, meaning that you're offering opportunities for kids to build skill and to develop. So let's go to the intervention point 5. I probably don't need to say anything here, right? Detention and confinement, we're looking for alternatives here wherever humanly possible, because we do know that there are better outcomes if we use evidence-informed treatment that's delivered in the home, in the community, with family involved. Let's go to the next slide. So this is the final intervention point, which is reentry. And to me, this is the culmination of everything that came up to it. I heard somebody talk about preparation and planning and repetition and practice, right? Preparation of family and youth for life beyond what that institutionalization or incarceration looked like. That means having good services in place. It means effective prevention and response for technical violations. We are still hearing from some places about kids sitting alone in hearings for their technical violations. And again, that shouldn't be the case, right? So trying to address their right to lawyer due process, having educational and vocational, i.e. meaningful experiences available to them, things that are meaningful to them and defined by them. That person that cares about them, who is that? Are they asking who that is? Mentoring and credible messengers. So that was brought up earlier, and Summit County is using credible messengers in their detention center, and they say it's going well. I think it's too early to know what that means, what those outcomes are. But I did take a quick gander, and I think it's Milwaukee where you might find some outcomes on the youth side with credible messengers. So it's an emerging practice, but one that we will, people will have to work to massage it into a solidly evidence-based practice. But I know that Summit County is hoping to partner with Department of Youth Services on building that further out in Ohio. And then some of those other things that have been mentioned. So here is the first 9 counties, and these are the priorities that have been identified. So number 1 priority in Ohio right now is the crisis continuum. That is also true on the adult side. You'll notice the number 12 exceeds the number of counties. That's because the specific items that were identified as priorities were different parts of the crisis continuum. So 1 or 2 counties had 1 or more crisis-related items that they needed to prioritize. But after that, we're talking about family support and family engagement, the availability and awareness of resources. So, and I saw Reba put in the chat, accessibility is what makes something available. So that's part of that issue, is making things accessible, and families have to know about it. They've got to know where to go. And then reentry and discharge services is number 4. But if you look at this, with the exception of that last one, detention center services, that was identified by one community, all of these things are cross-intercept items except reentry. Reentry is the only specific intercept that's kind of called out as a priority. So that really speaks to today's convening. Next slide. And I think I'm just about done. I just wanted to show you and share with you how the priorities on the youth side compare with those on the adult side. I mean, youths and adults are not the same, but many of the systemic issues that we've got are overlapping or very akin to each other. Crisis continuum, number 1 for both. Family support services, you saw, is number 2 for youth, right? But the availability and awareness of resources, both, right? Reentry and discharge services showing up in the top 6 for both. Information sharing, data collection, and that includes screening and getting the right data to make decisions, both. Transportation, both. So those 2 systems really, I think, could work together on some of these items if they wanted to kind of get economy of scale. And I think that's it. And I'm going to hand off to Brittini.
Thanks, Ruth. Thanks, Brooke. Thanks for setting the stage. I'm going to really wrap us up here with a high-level overview of how we have put the research into practice, and then kind of end with talking about where do you all fit into this picture based on your profession or personal interest. So just another quick myth busting. treating young people in the justice system the same way we do adults is effective for public safety and rehabilitation. That is actually not true. And I think that we heard that not only in the first couple presentations, but also from Brooke and Ruth, that in fact, treating young people as adults can lead to lifelong negative consequences, like permanent criminal records, higher recidivism rates, and an increased risk of harm in adult facilities. So we do need to approach things differently. And we've made a lot of progress over the last 30 years. I can remember when I first came into the justice system over 25 years ago, we didn't have the understanding and the research to guide this work. My mentor actually called it whatever worked therapy. Find what's good in the youth and build on it. And now we have framework around that called strength-based practices, right? So we've come a long way. So let's jump into what are some of these items that we employ that the research has driven, not only in juvenile justice systems, but at the Ohio Department of Services. So let's start with the risk-need responsivity that we've heard a lot about this morning. You can go to the next slide. So how do the courts and DYS identify risk and criminogenic needs? So kind of starting on the front end, right, with those light touches that we've talked about, we have things like SBIRT, screening, brief intervention, and referral to treatment. This is really an evidence-based public health model designed to identify and address risky behaviors before they escalate and before somebody gets deeper into those behaviors. Things like alcohol, tobacco, prescription drug misuse, things like that, as well as criminal behaviors. We also have the Ohio Youth Assessment System. So, oh yes, if there's one thing that you know from attending this conference and being involved in the juvenile justice and criminal justice world, it's that we like acronyms, right? So I'm going to be throwing a lot of acronyms at you. I did try to spell them out to make sure that you understand what we're talking about. But we also have oh yes, and that's a set of 5 assessment tools: diversion, detention, disposition, residential, and of course reentry, to identify the youth's needs and guide their care plans. So in addition to OYAS, we use medical, mental health assessments to also identify how those needs may be impacting their behavior and their criminogenic needs. Now, as a young person, sorry, Brooke, just go back one more time, sorry. As a young person, gets deeper into our system, we have to keep assessing them, right? Because things change. And so it's imperative that we continue to assess them as they penetrate the system, including while they're in our system. And so we use a CANS assessment, which is the Child and Adolescent Needs Assessment, that helps not only guide what the child needs, but identify some of those family supports and strengths that we can utilize in their habilitation. And then, of course, go back to that medical and behavioral health assessment. So we need to make sure that there's not anything medically that's impacting their mental health or something that's mental health that's impacting their physical health. So we have to do all of this coupled together. Next slide. So we know, and as we've heard today, that light touches are really the most effective intervention at reducing recidivism. And so if we can delay that first point of contact with the juvenile justice system, we have a lot better outcomes. So we have intervention and assessment centers. These are community resources. They provide a neutral, kind of single point of contact for young people and their families who may be struggling with some behavioral or other challenges that have brought them to the system. Ideally, these systems are not in the court system. Ideally, these intervention and assessment centers are at a community provider, so that that young person and their family does not have to cross the threshold of the court building. The main goal is really early intervention and diversion, which we know goes a long way. How do we connect these individuals to appropriate services, these community-based services, these supports that are in their neighborhoods, and that can prevent them from further penetrating the justice system or even the child welfare system, because we do have a lot of crossover. These centers are connectors. They assess needs. They coordinate resources. They know where the resources are, because oftentimes when families are in crisis, they don't know where to go. They are in survival mode, right? So how do we let them know what those resources are and help strengthen that continuum of care that we've talked about for our vulnerable young people and their families. Now, Ruth touched on JDAI, definitely an important initiative. And if you're going to be in the in-person sessions tomorrow, you are going to hear a deep dive into JDAI. Not to steal their thunder, but I did drop a link in the chat with the Annie E. Casey Foundation website. This is a nationally recognized evidence-based program designed to reduce the overuse of juvenile detention and improve those outcomes. Again, when 25 years ago, we would put a kid in detention for running away. We would put a kid in detention for skipping school, not knowing what the research tells us now, that we are actually exposing those kids to further criminogenic behaviors and potentially impacting them to have longer involvement with our justice system. So it's really important that we find alternatives, things like house arrest, family placements, respite, things like that, connecting people with services. And of course, something that we've heard over and over and over again, and yes, Ruth, you are correct, upwards to 70% of the young people in the Department of Youth Services are on a behavioral health caseload. So how do we utilize these programs like BHJJ, the Behavioral Health Juvenile Justice Initiative? This initiative provides funding to courts designed to identify and divert these young people with mental health and substance use challenges to community-based treatment. We have funding at DYS. It's shared from Department of Youth Services, from us, as well as OMAS, the Ohio Mental Health and Addiction Services. And right now we support 10 local programs serving 15 counties. And this includes the Mental Health Recovery Board. This includes the juvenile court in that county. It includes the behavioral health providers. So again, this cross system, this intercept of collaborations in order to meet the needs of the youth that we are seeing and that are touching our system. There are some other practices that we utilize: family functional therapy. It's evidence-based, specifically used to address young people involved in the court system and help address those family dynamics to reduce criminal justice involvement. We have the multi-systemic therapy. We have a huge initiative going on across the state with this, and it's really intensive, family and community-based for adolescents with serious behavioral or substance use challenges. We want to avoid out-of-home placement. We see more success when the young people can be connected to those closest to them. So this is delivered by a team of therapists. They are on call. They create long-term plans. And really looking at changing that family system long-term so that they can stay out of the justice system. Next slide. I'm sure a lot of you have heard of cognitive behavioral therapy. If you've been in this world, CBT has been quite a buzzword over the next decade or so. And this is really a type of therapy that addresses changing the negative thoughts and behaviors to improve mental health and well-being. We also have CBT-based groups which utilize those principles and techniques of CBT to help people manage their thoughts, behaviors, and interrupt those negative thought processes. We have other services. So some of these things are done on the front end. So that first slide that I just went through were things that we really try to do upon that initial touch with the juvenile justice system. So utilizing those services in diversion and intervention practices, or even in probation transformation. And then some of these other ones are ones that we utilize more so when a young person is either in a residential treatment treatment or potentially in one of our facilities or one of our community facilities. Things like aggression replacement therapy. So how do we help them manage that emotional regulation and their responses and that moral reasoning to having empathy and understanding on why we shouldn't hurt other people. Sparks, structured psychotherapy for adolescents responding to chronic stress. So you may or may not know, like, the Department of Youth Services mission statement, but it is really to improve Ohio's future by habilitating youth and empowering families and communities. And that was really intentional on why we use that word habilitate, because we cannot assume that the young people that are coming into our system, and even adults for that matter, have the skills to interact with the world around them. But we can assume that the majority of the individuals who come into contact with our system have experienced trauma. They have dealt with challenges when it comes to social determinants of health. They might not have known where their next meal was going to come from. They may have experienced homelessness. They may have experienced abuse at the hands of people who have loved them the most. So how do we work to rewire these young people's brains from dealing with that chronic stress over a long period of time, right? EMDR is another practice that we've been using, and that is eye movement desensitization and reprocessing. It's a psychotherapy technique used to treat a variety of mental health conditions, including post-traumatic stress disorder, anxiety, depression, and phobias, many of which do plague the individuals that come in contact with our systems. I already mentioned this earlier, but of course, we need to utilize a lot of other partnerships in order to habilitate and move individuals to be prepared for reentry and to go back into our communities and to interact with the world around them. So we utilize behavioral management programs like PBIS and PRIDE, victim awareness programming. So we create opportunities with youth involved in the system to do apology letters, to do community service, restitution, to try to understand the harm that their crime may have caused, and to try to make that victim whole again. Restorative justice is a huge part of that, and definitely something that you'll hear more about throughout this conference. And then, as we've heard over and over from our presenters just in this short time together this morning, family and community engagement is key to this young person's success. We know, and research tells us, that having one caring adult can motivate a youth to stay on track and become a contributing member of our society. So we need that community. We need that family engagement piece. Next slide. So as we talk about identifying the barriers to reentry, and I think that Ruth just said this, and it was said earlier as well, we have to prepare. So how are we preparing our young people when they are in our care and our custody? Education is a huge piece of that. Now, I will say, 20 years ago, the young people in our facilities were younger. The makeup was 15 to 17, whereas today we are looking at more 19, 20, 21-year-olds at that far end of that youth age continuum that we have jurisdiction under. So education is a huge piece of that. So making sure that we have credits, we have IEPs, we have neuropsychs in place, so that we understand how this individual learns and can connect them to the right services through their education. Something that's new and very exciting that we're doing with the Department of Youth Services is the Buckeye United Industry and Leadership Development Program, or the BUILD program. And this really provides advanced training skills in emotional regulation, soft skills, customer service, problem solving, how to use technology, and really enhancing the young person's training and employment skills so that they do have these skills when they go back out into the community. I already talked about community service opportunities. So even if a young person doesn't owe community service in order to pay back for their crime, they have opportunities to volunteer in our facilities, work in janitorial services or the kitchen, and they have an opportunity to earn some money in that process where that can go in a bank account so that when they get out, they have financial means so that they don't have to go back to a life of crime. I already talked a little bit about that victim awareness programming. Occupational therapy is huge within our systems, understanding the zones of regulation, that mind-body connection. It's like, why is somebody upsetting me? Understanding our triggers. And if we don't have those conversations with our young people, they are not going to be equipped to go back out into that community. Next slide. Planning. So we have started implementing PRPS, which is pre-release planning sessions. So we are coming together in those 90 days prior to a young person being the planning actually starts from the moment a young person steps into our system. But we really take a hard look at this when they are preparing to re-enter and go back into the community. What is the plan for housing? Is it safe for them to go back to the place that they came from? Are their parents, are their family members still around? What does that education and employment look like? So do they have a high school diploma? Do we have opportunities for employment? Do we have partners in the community that meet their skill set? Through the BUILD program, they have an option to do some virtual reality career exploration and identify where their strengths are so that we can connect them with those employers that will give them that second chance upon return. We have important documents. So I know that was mentioned also as a barrier earlier when Brooke was talking, do they have an ID, a social security card, a birth certificate? We have partnerships, and so does the Department of Rehabilitation with the BMV so that we can give young people a YORIC is what we call them. It's a card, identification card, that they can then take to the BMV and get their state ID free of charge. It's really hard to go out and apply for jobs and apply for services if you don't have an ID. Access to support services. So where are those in the place that they're returning? What does that behavioral health support look like? And what are those medical needs? And do they have insurance coverage? How can we make sure that they're connected with Medicaid when they're released so that there's a continuous process of those supportive services? Next slide. And then how do we leverage those strengths, right? We have more graduates in the Department of Youth Services than ever before. And so that's why we're creating these programs like the BUILD program to give them opportunities to build some of those employment skills, right? What do those higher education opportunities look like? We have partnerships with Stark State, Columbus State. I mean, there are community colleges and other colleges where we have young people that are in our facilities taking college classes. A lot of times people look at these young people as throwaway young people, and they are not. They are capable, they are smart, and they are going to be doing some great things in their future. We also have more young people in step down opportunities. So let's take them out of our 3 main facilities. Let's step them down to a community correctional facility. Let's create an opportunity for them to go to college in person, to go to a trade school. And again, I don't want to steal thunder because my colleague Larry is going to be talking about a really cool initiative in the next session after lunch to talk more about that partnership with the Trades Institute in Greene County here in Ohio. Next slide. And then how do we connect them to resources? So again, those partnerships with higher education, with our schools in the community, with employers, with second chance employers, with trades, apprenticeships, re-entry programs. So not only does the Department of Youth Services have a re-entry program, a lot of our local courts also have re-entry programs, Franklin County, Hamilton County. And so how do we partner with them to make sure that our young people are aware of what services are available? I'll tell you what, the faith-based community has carried a lot of the people that we serve for many years. Where is that safe place that they can go, where they can connect to something bigger than them, where there's forgiveness, where they're welcomed back with open arms? So our faith-based programming is very important as well. Mental health services, and then again, those community support services. Where are those places where I can go? Credible messengers, mentoring, things like that. So just to wrap us up, so we have a few more minutes and some time for Q&A. What does this look like for you? So I know we have a wide variety of individuals. Some of you are involved in the justice system, and I am, speaking to the choir here. But some of you are caring individuals in the community who want to know how you can make an impact in this. How do you fit into this continuum? How do you support these individuals when they are returning to our community? And I think that we need to get back to the mindset that it takes a village to raise a child. And that when we are raising children, that is up till 21 and ongoing, right? So what are your strengths? What are your strengths? What are you good at? Do you have experience? Have you had lived a life with lived experience and resiliency, and you have come out on the other side? Have you considered being a mentor? Have you considered that your story could lead you to be a credible messenger? Do you vote? Are you a registered voter? Do you understand how the policies that you are voting for impact our justice-involved individuals? Advocate, talk to your leadership, talk to your elected officials, know what you're voting for when it comes to mandatory sentencing, right? So understanding those things. I'm not one way or the other, but understand and advocate for what you feel is right. Do you own a business? Do you own a business? Are you a second chance employer? You can become a certified second chance employer to offer opportunities to our young people and our adults that are coming back to the community, because that's what they need. They need a chance. They need somebody to give them a chance. And then that chance becomes the hope for them to continue on this path of not engaging in criminal behavior, to continue on the path of recovery. Do you teach financial literacy? Do you have a law degree and you're retired, but you want to get more involved? We have a state advisory group. You can go to the Board of Commissions and apply to be part of the state advisory group, where you can help guide criminal justice reform ongoing. So just thinking about those services, who you are, what are those strengths? Who do you have those relationships with? And see how you can give back. What does that look like for you? We are all very busy people, and today we're pulled in a lot of different directions. So identify that passion. What's in your heart? And what does that look like for you to impact the justice system ongoing? We need collaboration. We need partnerships, and we need relationships. And we know that healing happens in relationships, so that we hope that you will take the time to build a relationship with somebody in recovery, with someone in reentry, with somebody who has that lived experience, that justice involvement, and see them as a human being and give them a chance. Thank you.
Oh, ladies, thank you so much for that presentation. I was having a lot of thoughts as I listened to it, and one, the first thing that came to mind is how much this arena has changed since I was a criminology student. And I'm not going to age myself by giving away the year, but I mean, there was color television. It wasn't that long ago, right? But there's been such an evolution when it comes to the approach, in at least in academics and in practice, for those who actually work in this space. And I think the gap is still in public perception and understanding, which, Brittini, just like you said in your closing, is where we see, advocacy and voting. So, there's definitely a bridge to a greater understanding with the community at large and how it drives the work that we do. So a lot to think about from what you've shared today. Quickly here, if anyone has questions, please put them in the chat. I will do everything I can to get you an answer and keep us on schedule. So I've got two jobs here. But Wendy Tarr had put a question in the chat when Brooke was presenting. And her question was if there was data or studies about youth with sex offenses and significant mental health diagnoses specifically. If there was any research with, those two factors and what that means for their risk of reoffending.
Sure. So there is no marked difference within the youth sex offending population. And I want to bring us back to some of the statistics given by Ruth and some others from this morning already, is that it is correct that 74% of the youth in Ohio's deep end, so incarcerated, are in the mental health unit. It's actually 74% of the boys, 100% of the girls. And so within that population, included in there are those kids with sex offenses. And so a lot of the difference between youth with sexual offending history and adults comes down to the motivations for the offending behavior in the first place. Unlike like kids are not diagnosed with pedophilia, they do not meet that criteria. Typically, the reason why young people sexually offend is because of their own victimization themselves, their own lack of knowledge of what is appropriate sexual behavior. And so interventions that are most helpful are typically those things which prevent victimization in the first place. So in other words, teaching young people what appropriate boundaries are and aren't. And a lot of it is kind of drawing those boundaries around normative sexual behavior and exploration for kids before they are either victims themselves or act out on other young people. And so none of the research that Elizabeth Letourneau is one of the foremost leading researchers on that topic. Mark Chafin, who unfortunately has passed away, but has a body of research on youth with sexual offense histories, is really youth who have those offenses are extremely unique, and they have very different needs and very different motivations than adults in the same population. And so the way that we treat them best is across the board. For young people, it's going to be the same interventions across the board.
Awesome. Thank you for that. We had a question in the chat about seeking additional information about becoming a certified second chance employer. Brittini was nice enough to put a link to that information in the chat. So if that is something that you are interested in, you can copy and paste that link right now. And hopefully that can meet some needs for you going forward. And then as we move to close here today, is there any light on the horizon? Any things that make you really optimistic, or models that you're aware of that we should keep an eye out in the future?
I think the credible messenger piece is definitely something that's getting a lot of movement. So that one I would definitely suggest, as is peer-led programming in groups. So we do have a lot of research. We know that the young people are going to listen to people that are more their age. So how do we do more leadership development and create those peer spaces for young people to serve as leaders?
Awesome. Thank you. And then, we have a question coming in from Miss Hosey. She writes, youth these days tend to walk the line of being mini adults and confused children. Obviously, there is guidance that's needed there. How often are children just engaged in conversation?
Engaged in conversation in the sense of, well, I'll just answer what I think you may be getting at, but also if there's other things, feel free to follow up. So the study that I mentioned earlier, Pathways to Desistance by Lawrence Steinberg, one of the things he talks about is there's a difference between intellectual maturity of young people versus social emotional maturity, which is how you can get a young person who can make straight A's in school, but then go do something really not smart, right? And then end up in trouble in the youth justice system. And that is because those two things are not the same. So I think that sometimes we see a young person who is really smart, really bright, quick-witted, and we equate that to the same level of social emotional maturity that we might to hold them responsible for their behavior in a different way. And so there's a distinction between those two kind of maturity buckets. And so that should drive kind of how we think about and consider how we respond to a youth's behavior, their treatment in the system.
Awesome. Thank you. Excuse me. And then Carrie was asking for the name of the study, Brooke, that you mentioned about emotional maturity. If you have that.
Sure. I will make sure that I get Jen the link to it so that you all can see it, but it's Pathways to Desistance. And it was groundbreaking. It's part of the reason that we stopped doing the death penalty for children, why we stopped doing life without parole for certain youth, is because what we discovered about adolescent development really should dictate how we engage with young people. So I'll make sure Jen has that and can distribute it to the list of registrants.
Awesome. Thank you so much. And everyone, this brings us to the end of our session. I want to thank all of you for attending. Many thanks to Brittini, Ruth, and Brooke for their time and their presentation today. Remember, we are using the same link all day, so we will be back in this virtual room at 12:30 for our Lunch and Learn. That session is titled Experts of Their Experiences. I'm going to turn it over to Reba before she sends folks on to grab their lunch. And I'll see all of you this afternoon. Thank you.
Yep. So thank you all. And thank you to our presenters. Amazing. I hope we are starting to see themes emerge from everybody who has presented today. One of the biggest things I hear is that one person can make a huge difference. Just one person can make a huge difference. And we can all be that person. We don't have to develop fancy programs or anything like that, but we can be that one person, and we can be that connector to that next one person as well. We don't have to be with a person for the full season of their maturity into adulthood. We can be with them for a season. And that's part of what we're going to talk about at the Lunch and Learn with folks who have been there, done that, and are giving back from their own lived experience.